A very good evening once again. You're watching News 9 Facebook Live with me, Adarsh Vepachedu. Did you know being a man, having a lower income, a lower level of education, not being married, and being born in low or middle income countries could lead to an increased risk of dying from COVID-19? Well, I was surprised too when I came across this research. The findings also showed that men had more than twice as high a risk of dying from COVID-19 than women. Unmarried men and women, including those who've never been married, or maybe widows or widowers, and even the divorced, had 1.5 to 2 times as high a risk of dying from COVID-19 as those who were married. So why is it this way? Well, the researchers say that men in general have higher mortality at comparable ages, which is in a sense due to a combination of both biology and lifestyle. Now, to tell us more about how these factors could be influencing the mortality rate, we have with us infectious diseases expert Dr. Pratik Patil joining us on the phone line. Many thanks, sir, for speaking to us. Could it be that people with little education or a low income have higher mortality due to lifestyle factors, including finances? In that, how much can one really afford to prioritize one's health?
Yes, possibly the because people with low financial control and low education possibly are not aware of the consequences and not as alert as compared to those who are well educated and probably presenting late to the healthcare facility compared to that is one possibility. However, we don't know how to immediate possibility. We don't have such as a device. One of the the study was done. So obviously we don't have this information in India and we don't know. But the personal experience or my experience about COVID cases here, I haven't seen many such cases here where the young men who are unmarried have death. So I haven't seen this finding here.
Okay. Dr. Pratik, looks like we're having a little bit of a difficulty listening to you and trying to understand exactly what you're saying. We're trying to get that technical glitch corrected, but yes, we're talking about how, in several countries, the conditions are not really favorable for people, and right from low incomes to not a very healthy lifestyle. There are several factors that really matter when it comes to how much of a mortality that a particular country really has at this point in time. But this particular very interesting study coming in from Sweden indicating that, those who are unmarried also could be at a higher risk of dying due to COVID-19. It could be obviously because of the kind of influence that the other half may have on a particular person. Now, coming back to you, Dr. Pratik, if we were to talk about a few earlier studies, even they have indicated, they have shown that single and unmarried people, and men particularly, have higher mortality from various other diseases, not just COVID-19. Please throw light on the connection between one's marital status and their mortality due to a disease.
As we know this, it's in COVID as well as many other diseases where the men are more at risk than women in general.
Okay.
And if you talk about the single, the study which you are referring to,
yes,
they have found that unmarried or single men and women have a higher risk. So possibly, obviously, it doesn't have anything to do with the genetics here, but possibly the lifestyle and the awareness. Obviously, if you have somebody with you who can who can look after you and help you in being alert and reaching out to the healthcare facility early, possibly that's what is making difference here. And if you're alone and nobody to look after you, maybe that is the differentiation.
And in this particular case, can we say that unmarried women are slightly better off than unmarried men?
In general, yes. That's a genetic difference here. Men are more predisposed for a severe disease and death in COVID than women.
Okay.
That even we are seeing here even in India that the complications are much higher, and if you see the complications, the survival is much better in women than in men.
Right. Now, Doctor, are these indicators or factors, if we can call them, common to other infectious diseases as well? And if you could just draw a parallel between what we've just discussed and with maybe a few other diseases, whether these factors, whether your marital status can really matter in a few other infectious diseases as well.
Okay, marital status, I'm not sure, but at least the sexual difference, like men and women,
Okay.
it's there in many other infections, including an influenza, where the women are better. They do better than men.
And this is something to do with the ACE2, ACE2 receptors, if I'm not mistaken on that?
No, I think this, in terms of COVID, it could be due to the ACE2 receptors, but we don't know about the other diseases. I'm not aware about what is the difference in other diseases, what is the differentiating point in other diseases.
Okay, but again, as an expert in the field, when it comes to this study, you do feel that it holds some water, that unmarried men may be at a higher risk of dying due to COVID-19 than otherwise?
Possibly, yes. I mean, don't have the reference or any studies from India. It's from one of
But
the
it could be
European
possible.
countries, but it's possible.
Right, right. Well, many thanks, Dr. Prateek, for joining us and for sharing with us your insights on this very interesting study that I came across just a while ago. It speaks about how, unmarried men, because of the kind of lifestyle that they may be living at the moment, are at higher risk of dying due to COVID-19 than other men who are probably married. So there you have it. Drop in your comments. Let us know as to what you feel about the connection being drawn between a person's marital status and the mortality due to any particular disease. Do let us know as to what you feel about this new, very interesting research coming in. But yes, until then, do stay tuned to News9 on all of the social media platforms, and like, share, and subscribe to us on News9, that is on YouTube, Facebook, Instagram, and Twitter. Many thanks for joining us.